So first of all, before we kind of dive into the meat and potatoes of this presentation, I wanted to take a moment to recognize the team that worked on this. My name is Kristen Parker, and I am the Manager of Nursing Professional Development and Practice Excellence for Periop Services at Hartford Hospital. And I get the privilege of working with a really amazing team of NPD professionals. So to give you a little background about myself, I have been a nurse now for 13 years. I did not start off my career in nursing. I had a bachelor's in molecular and cell biology, actually, and I did clinical research for 5 years before I went back to nursing school. I decided that Petri dishes and gene tracing was not really personable enough for me. So I went back to nursing school and I got my nursing degree. Before transitioning to perioperative services 3 years ago, I actually was a critical care nurse and a critical care nurse educator. So some of my colleagues here who I've worked with at previous organizations were like, why are you in periop now? You're an ICU nurse. And I had the privilege of joining the perioperative team of nurse educators back 3 years ago. And I have loved the ability to learn a whole new specialty practice of nursing. I actually functioned as the peri-anesthesia nurse educator at Hartford, and then I transitioned into the role of manager just over 2 years ago. So our perioperative team on the left side, my team is actually a total of 4 staff members that cover various areas within the perioperative space, but we have Lynn Masoya and Cassandra Eilers. Cassandra's actually presenting in the other room. I'm a little sad I can't watch her, but that's okay. I get to be here with you guys. Combined, these two professionals have over 35 years of experience in perioperative nursing, quality, safety, education, and professional development. So really a mountain of expertise there. And then we actually were able to have a true collaboration with Connecticut State Community College. And over on the right side of the screen there is Tim Gregetz, who is the director there. And he has been a certified surgical technologist, a CST, for the last 16 years. He began his clinical career at Hartford Hospital after he graduated from Manchester Community College. He transitioned into the role of a CST educator in 2019, and then the director of the program in 2023. So this collaboration between our academic and clinical partners is really the foundation of the work that we've been able to accomplish. So now that you've had a chance to kind of meet the team who worked on this, I want to share with you a little bit about the context. So what does our organization look like? And I know some people are from Connecticut, some people are not from Connecticut, so to give you some information. So Hartford Hospital is a large 867-bed level 1 trauma and transplant center, and part of Hartford Healthcare's multiple site healthcare organization across the state of Connecticut. So each year we complete between 50 and 55,000 surgical and procedural cases. And actually it's just over 53,000 for fiscal year 2025. And we have about 60 ORs that were a part of those surgical cases. We have a perioperative nursing professional development team that encompasses 7 total full-time staff, including myself, that provide education and professional development for about 600 perioperative staff. 29% of our perioperative staff are CSTs, and we have 10 leadership teams that we work with and 4 campuses. So it's a huge scope and scale, and this scale really means that we needed a consistent pipeline for recruiting, developing, and retaining our perioperative talent, which is where this fellowship program came in. So now that you have a little sense of the context, I want to share with you a little bit more about our surgical technology training in the Hartford region, for those of you who may not know. So Manchester Community College was founded in 1963, and in the early 1970s, they started a surgical technology training program. So in 2017, they formed a consortium agreement with Hartford Hospital to address staffing shortages and improve our CST training quality. The college provides academic instruction, academic support system, support services, and they ultimately are responsible for awarding that associate's degree for surgical technology. Hartford Hospital provides the clinical facilities, lab instruction, and qualified surgical technology instructors. And the Surg Tech students actually get to complete their clinical rotations primarily at Hartford Hospital, but now that has expanded to outside of just Hartford Hospital, and they actually go across our entire healthcare system. And then in 2023, Manchester Community College became a part of CT State Community College. And fortunately, this consortium agreement continued uninterrupted. So we've been able to continue to grow that relationship and expand our training. And that partnership still exists today. And we've been able to build on that foundation with our Surgical Technology Fellowship. So now that you have a little awareness of the history of Surg Tech training in the Hartford region, I'd like to give you a little bit of information about this unique program, because I know it's not something that exists everywhere. So each year, for the past several years, we enroll 20 students in this program. And over the past 8 years, we've had 96 students complete the program. And I'm happy to say that they have a 91% passing rate on the national certification exam, which is far above their accreditation standards. Students routinely graduate with over 150 cases per each student. And that's compared to the ARC STSA required 120 cases. So that really sets them apart in the job market when they're trying to find a permanent position somewhere. The clinical rotations can take place at any one of our 7 acute care hospitals. So we really have a wide breadth of coverage. And last year, in 4 months of clinical training, the Surg Tech students, 17 of them who got to that point in their program, touched over 2,700 patients. So that's a huge impact on their competence and confidence as they enter the workforce, and it illustrates the program's significant role in preparing skilled, practice-ready Surg Techs. So we didn't stop there with our attempts to continue to build our pipeline. Hartford Hospital really wanted to continue to develop that sustainable workforce. So in 2020, they actually created a unique role for student surgical technologists. And this was a role that enabled them to be hired as a per diem staff to the organization. In a student role, they could get paid, and then they could build their clinical skills by working one-on-one with a preceptor. So they could, this new role was open to all of our ORs, so anybody could come in and work in one of our specialties. We have multiple departments. And they had a very defined scope of practice that aligned with both our state and hospital regulations, so we weren't running into any issues with regulatory bodies as far as their scope of practice. It also gave us a way to fast track their onboarding. So we all know onboarding can be a little onerous and tedious. So our thought was, if we can get them in when they're still a student and get through their onboarding, when they transition into a permanent role, they're hitting the ground running. They're going right with their orientation, and they've gotten all the HR piece done. And I realized I forgot to write it on my first slide. I was going to poll the audience to see who was in here. So I'm going to take a break. And I just want to see, just so I understand where everybody is, if you can just raise your hand, how many nurses do I have in the room? Like bedside nurses? Yeah, frontline nurses. I'm going to get to leaders in a second. Okay, so no bedside nurses, but that's okay. How many nurse leaders do I have in the room? So either operational leader, perfect, directors. Okay, do I have any educators in the room? We have some educators, perfect. What about surgical technologists? Yay, whoop, whoop. Love you guys. Anybody else, maybe SPS or other leadership roles within perioperative services? Great, awesome. That helps me kind of know who I'm talking to give you hopefully some examples. So as I said, this kind of laid the foundation. This particular role laid the foundation for what became our Surgical Technologist Fellowship. So the per diem role was a great start. We were really happy to be able to offer that. However, there were some gaps in its implementation. So what we found is that students were often onboarded without any consideration to their academic obligations. So they would be onboarded if they finished their program in the first week of May. They were onboarded the end of April, and then they were studying for their exams, and they didn't get to pick up any clinical time. Some of them were onboarded much earlier in their semester, so they actually did get experience in the clinical realm. but it varied from person to person, year to year, and department to department. And it also made it really challenging sometimes for them to actually complete their HR onboarding. So that was obviously an issue for us. Didn't let them engage in any of really the nuts and bolts of the program, was really building their clinical confidence. Another issue was that the reporting structure and manager expectations varied quite a bit from department to department. As I mentioned earlier, we have 10 leadership teams across all perioperative areas, and 7 of those are OR managers. So it really was kind of up to the individual manager to determine how they were going to implement that role within their unique department, making it varied between students. We wanted to make sure that we aligned this program with their academic timeline, because we found that if they're working, picking up hours at the end of their program, we were concerned that that could affect their ability to pass their final exams or their certification exam, and we didn't want that to impede their academic success. We also wanted to help foster professionalism by enhancing the interview, screening, and hiring process, and implementing some rigor and consistency to that. And hoping that, this program would provide consistent benefit for both the organization and the student. It's not just about us as an organization, but we wanted to equip these students. So since there was really, my team, what we ended up doing was kind of looking to the literature, right? We see a problem, we see a gap, we want to look to the literature and for it to tell us what are the options that we can do to try and implement at our organization. And what we found, nothing. There really isn't anything defined in the literature that talks about an externship program for surgical technologists. So in response to that, what we ended up doing was looking to some of our existing programs within the system, and that's where we ended up at looking at our nursing fellowship programs. So Hartford Hospital has a long history of engaging nursing students in the OR and perioperative spaces. So in 2016, Hartford Hospital actually started the Operating Room Nurse Fellowship Program. And this is a program where student nurses in between their junior and senior year come and do an 8-week externship in the operating room, one-on-one with a preceptor, to build their awareness and skills. And it started off very small. Only 2 student nurses were hired in that first year, and then very quickly expanded, because as some of you who are nurses in the room know, there's not a lot of exposure to perioperative settings in the academic world. And we saw that as an opportunity to be able to be like, let's engage these students. Let's open the doors to the ORs and show them what perioperative nursing and perioperative practice is like. So in 2020, the demand was so high that we actually expanded that operating room fellowship across the entire Hartford healthcare system. And then in 2022, our team of nurse professional development specialists hired a PACU nurse educator, and they were like, well, why can't we do it for the PACU? So we started a PACU nurse fellowship as well. Building on that success even greater, our entire healthcare system got kind of wind of this, and a couple other pockets that were doing this, and we expanded it to our entire system and multiple service lines in 2023. So we include critical care, ED, labor and delivery, perioperative nursing, med-surg, behavioral health, ambulatory. Every area can have fellows now. And in 2023, 81% of those fellows actually stayed on within the organization for their final year of nursing, which our hope is that if they stay on with us during their senior year, that they'll hopefully be willing to stay on as they graduate from their nursing program. So we kind of used this as a roadmap and said, how can we apply this to surgical technologist training? So this is where we started kind of brainstorming with our partners from CT State Community College over the summer of 2024, trying to figure out how can we make this work. And we recognize there's some big differences between nursing academic programs and surgical technology academic programs. I mentioned before that our nurses kind of join us during that summer, so they don't have any academics usually that they're working on. But our surgical technologists it's an associate's degree program. They're usually joining us once they start their clinical rotations, which is really at their last semester. So we knew we were going to have to figure out some way to simultaneously engage them in the fellowship with their academic obligations as well. And we really wanted to balance that academic and clinical demands so that they had a meaningful experience. So we structured, we had defined timelines and clear roles for our fellows and consistent expectations so that the students could focus on their growth rather than the logistics of the program. It was important for all of my team members, as well as the director of the program, to ensure that this fellowship did not impede the academic program success. We didn't want students participating in this to affect their accreditation at all. So that's really a part of where that collaborative partnership came in. And we also changed the reporting structure. So kind of mirroring it after our nurse fellowship, where the nurse fellows actually report to me as the manager of nursing professional development, single manager, single vision. The search tech fellows also reported to me. So we were able to kind of really control the design of the program. They were required to work a minimum number of hours per week, which was 4 hours, but they had the ability to pick up extra if they wanted to, but we didn't want to require more than that because, again, we didn't want to impede the ability for them to be academically successful. And in addition to our to providing clinical experience, we also wanted to make some really specifically curated learning experiences. And that hope is that we would be able to develop their confidence and competence in the OR. So we started with kind of looking at the timeline. So as I mentioned earlier, we had some of our student surgical technologists that were onboarded right before their final exams, which really doesn't provide any value for either members of the relationship. So knowing that our academic director really wanted them to be done with the fellowship before they start studying for final exams, that was our end date. So that was May 2nd. We then kind of started tracking our way back and looking at this. And if we wanted an 8-week fellowship, we knew they had to start March 10th. At our organization, it takes about a month, about 4 weeks to complete all of the necessary HR, occupational health, background check, all of that stuff takes a month. So we knew that they needed to be hired in our system and accepted the offer by February 7th. We wanted to give a month for us to be able to do the screening of the candidates and the interview process and hiring. So we knew the application deadline had to be January 10th, giving them 4 weeks to try and gather all the necessary application requirements. We posted the positions on December 2nd, and then we had to start socializing it in October and November. So it was a huge shift. It was a big shift for us to be thinking about this proactively. And even now in October, I'm already thinking about spring of 2026. So big shift for us to kind of have to think about that differently. So as we finalized the schedule, we then focused our attention onto designing that meaningful curriculum, which was really important to us to provide that structure for our fellows. So the curriculum development was really guided by principles of adult learning and professional role transition. And our goal was to enhance and not duplicate any of what they were learning in their clinical settings. So, during clinical rotations, the students are really focused on mastering their skills and learning the surgeon's preferences. So we wanted to provide something that gave them a little bit more of a broader context and understanding to kind of connect those technical skills to the bigger picture and how the entire perioperative team works collaboratively. So obviously, we wanted a big chunk of this to be clinical experience. So half of the time was devoted to clinical experience. And then we also included the other half to be observational experiences. And we wanted them to, encourage systems thinking and teamwork through those experiences. We wanted also for them to see how the surgical technologist contributes to patient safety, communication, patient flow, how their work connects with anesthesia and the other providers in the room, and then the people who are our support staff, sterile processing services, nursing, materials management, preference cards. So this blended approach was really designed to both build technical technical competence and professional awareness, hopefully helping their transition into clinical practice. So with this focus on systems thinking and collaborative partnerships, we then transitioned to providing some really guided and to kind of expanding on those guided observational experiences. So you can see here, obviously in the center, the largest portion of that time, as I mentioned before, was really in the scrub role, one-on-one with a preceptor. We wanted them to spend some time outside of the scrub role, just observing in the OR. And I don't know any of you who've learned a new skill, but when I'm learning something new, I am totally 100% in the moment focused on that. I am not aware of what's going on around me. If my husband or my kids are talking to me, I'm not always paying attention to them. And we recognize that adult learners can sometimes do that. So when they're scrubbed in, learning the skills and paying attention to the surgeon, they're not paying attention to what else. And we all know there's a lot of movement going on in the OR. There's a lot of stuff that happens. So we wanted them to get out of that role and actually look and observe how the team communicates, what the different roles and responsibilities are, so they understand their role in the process. We truly felt that that was a priority. When they were in that scrub experience, that scrub role, they had pretty much almost all of the scope of practice of the CST role they were able to do. For our organization, we eliminated the ability to do independent surgical counts, medication management. We did not want them handling implants. They couldn't do specimen management independently. And per our organization, they could not do any titration of the oxygen or help at all with that. And then we also kind of gave them some additional experiences, right? So we had them sit with our preference card manager and our materials management so that they could learn about fiscal responsibility and supply stewardship. They spent time with our OR assistive personnel so they could understand patient flow and movement and room turnover and equipment management. They spent time with our OR front desk so they could understand what happens when the nurse calls out to the desk and, or the desk calls into the nurse. What's going on out there, right? How are these patients moved in and out of the perioperative space? Lastly, we had them shadow an anesthesia provider to understand the importance of prioritizing patient safety during during induction and emergence. And we also had them spend time in our sterile processing department because we knew that we wanted them to understand when you're cleaning up your instruments, what happens at the other end of that when you send those instruments back downstairs. So together, we hope that these experiences would help them see the full scope of the perioperative team functions, building that respect, collaboration, and communication. Next, to make sure that every fellow had a clear direction and understand what the purpose of each of those experiences were, we created specific learning objectives. So these focused on understanding perioperative workflows, understanding the various roles within the surgical team and the perioperative team, strengthening communication and collaboration, reinforcing safe patient practices, and then of course building that confidence and competence in their scrub role. And by setting these, we really hoped and made sure that every experience, whether they are shadowing in sterile processing or anesthesia or supply management, had purpose for them. It also gave us some measurable points for evaluation. And as this program continues to evolve, these objectives will hopefully help us track some of our outcomes so that we can justify the return on the investment from the organization and our academic partners. As well, it'll help us ensure that we're meeting our organizational goals and the students' needs. So now that you've kind of seen a little bit of the program, I'm just going to give you some information on how our first cohort went. So we had 19 students enrolled in the Surg Tech program at the time of application. 11 of them applied to the fellowship, and 8 of them met eligibility criteria by the time that we actually started our screening. And we hired all 8 of those. They interviewed well, and we wanted to ensure that everyone had an opportunity to engage. Unfortunately, we had 5 of them withdraw prior to the program start, and I want to talk about that a little bit. So they applied to this program in December, and that was when they were only completing the didactic portion of their scrub training. In January, they started the clinical portion, and what we hypothesize is that that transition and the burden burden of the academic demands with an additional position on top of that was a little too much for some of our students. And we respected that and we didn't hold that against them, but we did move forward with the 3 that were hired and completed the fellowship. They collectively logged 108 hours of fellowship time. And although our cohort is very small, we had 2 out of 3 of those surgical technologists take permanent positions within our healthcare system. So from my perspective, although the cohort's small, that is a success for us. So now that you've seen a little bit about some of the data, I'd love to share with you what the fellows had to say about the program themselves. The feedback was really valuable for us. And all 3 of the fellows said that they appreciated the diversity in their clinical experiences because that really gave them the ability to work in different perioperative settings. And we did that intentionally because we wanted them to see clinical experiences that they may not be able to see as a part of their clinical training. There was some limitations on what types of cases they could actually do. And as an employee, we have a little bit more flexibility for them to see different types of cases. So they were really appreciated that. However, they did share candidly some opportunities for improvement for us, mainly stemming around communication and clarity with the OR teams. So as I mentioned earlier, we have a very large perioperative department, and what we actually found was that there was some issues with communication, the OR teams actually knowing that they had a fellow joining them for the day. So that's something we want to focus on next time to be able to really improve and bolster that communication so they have the optimal experience. So overall, they were very enthusiastic and said that they would recommend the fellowship to future cohorts. Their biggest suggestion was actually to have their fellowship and clinical hours at the same location, which I'll give you a little background. When we designed this program, the intent was to have kind of operationalize it in 3 phases. The first phase would have all of the fellows just at Hartford Hospital. And the reason for that was, as you can imagine, trying to make sure that we had a little bit of oversight and control over the specific program. Then we knew we wanted to expand it to the entire system because it's not just Hartford Hospital that needs pipeline development, it is our entire system with surgical technologists. So we knew we wanted to expand it to other locations in our system. And then our third phase was to think about how can we open this program to other training programs in our region. So are there, we only have one other program in the state of Connecticut, but maybe we can engage that program with one of our hospitals that's in the region. Maybe we can engage programs from Rhode Island and from Massachusetts, just to kind of work on building that pipeline. And then I went and got out of my slides here, getting too handsy with the projector there. The button. So we already knew that we were going to do that. So that feedback was not really surprising to us. So we really want to be able to, when students are placed in their clinical rotations across our system, the placement is really based on where they live within the state. Although our program is at Hartford, a lot of the students come from other parts of the state. We want to build the pipeline regionally, not just at Hartford. So building those relationships with the local teams is really important. Helping them feel comfortable when they're in their clinical and their fellowship hours, already knowing the surgeons, the procedures, kind of getting to know those teams, it was really important to us. And of course, they did ask for more scrub experience, which we were not surprised. So we would like to be able to expand on that in our future iterations of this program. And then kind of looking ahead, so looking kind of to this year and or 2026, how we plan to improve this program. So one thing we definitely want to do is implement system-wide. I already talked about that to help support local pipeline development. We also would like to develop some strategies to mitigate that late withdrawal from the program. Sorry, I'm standing right in front of you, I don't know if you can see. So there's a couple things that we're thinking about doing with this. So rather than having it be 8 weeks altogether, our thought is maybe we move that start date up and they have the total number of hour requirement that they have to meet, but it's spread out over a larger number of weeks. So that gives them a little bit of flexibility. Let's say they have a final exam one week and they're like, I cannot pick up any hours this week. They have a little bit of flexibility built in. So that's one thing that we're thinking about doing to kind of help mitigate that late withdrawal. We also would love to be able to create a formal post-program evaluation because we want to capture that consistent feedback so that we can continue to improve this program as we move forward. And we want to begin tracking some key metrics. So I have some data, but because the cohort was so small, it's not really quite meaningful yet. But looking at things like conversion rates, retention rate, how do we retain these people who go through this program? Orientation satisfaction, what was their perception of how easily they transitioned into a full-time role? Are we able to affect overall orientation length at all by having this program? So those are some of the metrics that we're thinking about incorporating and want to incorporate this year. And ultimately, we believe that this program can have the same impact that our nurse fellowship has, strengthening our surgical technologists pipeline, improving readiness, fostering that professionalism, collaboration, and teamwork across all of our perioperative departments. So I have a reference page, and then I am happy to take any questions or suggestions. Yes.